choice. Rethink.
Your life, your choice.
Rethink.
Rethink.
Rethink. Your life, your choice.
Rethink.
Your life,
Rethink.
your choice.
Rethink.
Rethink.
Your life, your choice.
Rethink.
Rethink.
Your life,
Your choice.
Rethink.
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 Your life, your choice. Winnebago's Healthy Living Partnership.
Hello and welcome to Rethink, Winnebago's Healthy Living Partnership, a program of the Winnebago County Health Department. My name is Lisa Brown and I'm pleased to be here today with Cheryl Labs, a coworker, a friend from the Winnebago Health Department, a public nurse, and Doug Guerin, Public Health Officer for Winnebago County. Hi, thanks for joining us.
Thanks for having us.
Thank you. So today we're excited to hear a little bit more about going back to basics, the origin of the Community Coalition and why we do what we do. So Doug, I know that's probably something you can best answer. Tell us why the Health Department pursued the federal grant.
Sure. Well, the origins of this program go back many years, Lisa. And you know that the Health Department worked in tobacco prevention for many years with the state as a partner prior to receiving the Drug-Free Communities grant. And we actually utilized that tobacco grant, leveraged those dollars to apply for a federal grant so that we could address issues related to alcohol, more tobacco work, and other substances of abuse in our community. So back in 2007 and 2008, we applied twice over 2 years to the federal government for a grant. We were successful on our second attempt and received that grant that started in the fall of 2008. That's when we hired you.
Yes, that was a good time.
And you came on with us.
Right.
And since our tobacco program and our new Drug-Free Communities program both had a community coalition component, we decided that it would be best to merge those two together and create what we now know as Rethink. The initial leadership development for Rethink occurred at the Health Department. You and others that were interested in helping us launch this community coalition participated on a leadership team. And that first year we applied for funding for the Healthiest Wisconsin Leadership Institute so that we could take our leadership team through that to generate leadership capacity and really form the structure of the coalition as it is today.
And that was so needed.
Yeah.
You know, the framework to get us going.
So we spent almost a year on that framework and planning while we were developing capacity in the coalition. And then about the same time that we did that, we were also launching with the City of Oshkosh Health Department in partnership a community health improvement planning process. And we pulled in many community partners. You know, I think we had at least 40 different stakeholders involved with that. And we identified through the community what some of the priorities were that made the community feel like would be beneficial to create a healthier Winnebago, a healthier Oshkosh. Once we spent several months in that process with our partners, we distilled that down to 4 priority areas. And then about a year ago, we folded in that community health improvement implementation piece in with the structure that we had developed formally for Rethink. And so now Rethink has expanded from not only from alcohol, tobacco, and other substance abuse, but also to other areas including physical activity, nutrition, obesity.
And that whole health promotion, right? And I understand you have a lot of data on how the community is doing in those areas.
So one of the questions that we get asked is, how do you make decisions about what your priorities are, what you're going to do? And what we have today is an example of one of the sources of data that we collect to help guide us in those decisions. And really, this data set is one of several data sets that we use.
Okay.
And each data set has its strengths and weaknesses, and so must be interpreted carefully and not relied on too much at any one data source.
Okay, and what's the name of the resource that you have today?
The name of the resource that I have today is our most recent behavioral risk factor survey, and that can go on screen. And this is a survey that is conducted jointly, and I'll go to the next slide here. And what I want to make note of is that the data that we're going to look at today is for Winnebago County, but does not include the cities of Neenah, Menasha, and Oshkosh.
Okay.
So it's just the 16 townships, Amarillo and Winneconne, that we have data for. We do have data for other areas, but it's not in this particular data set. We actually just got this data within the past week, And I wanted to recognize the partners that we worked with on this data assessment: Affinity Healthcare, Aurora, and ThetaCare. They partnered with 4 of the area health departments: Winnebago County, Calumet County, Outagamie County, and the city of Oshkosh, to conduct this survey all at about the same time so that we would have more regional data from which to work with. The Fox Cities did a similar survey a little bit before this, and so now about every few years or so we anticipate conducting this behavioral risk factor survey.
Awesome.
This survey was 400 interviews, mostly landline, some cell phone interviews to help make sure that we get a good cross-section of the population. Many families now don't have landline phones, they only have cell phones. The youth often rely on just cell phones. And so 400 people were interviewed, and these were only adults. And you can see that 1 percentage point, to get a perspective when we're reviewing the results, equals about 464 individuals. And you can see that in the Winnebago County Health Department service area, there's a little over 46,000 persons 18 years or older, about 57,000 persons total. So what I'm just going to do is quickly run through this data to give you a sense of what it can tell us. And how it helps us make our decisions. And so one of the questions, and we're going to run through about 19 slides. There's actually about 85 total slides, so this is just a small portion of the total survey, but it'll give you a taste of what this data can do for us. And the first question was, what's your overall health status? How would you say that your overall health is? And you can see that for Winnebago County, on the lower left is the most recent result. That's actually this survey. The rest of the chart, the graphs to the right, are previous data, and then data that we can compare to the state and to the nation. And so what's great about this behavioral risk factor survey is that we use questions that are also asked in similar surveys at the state and national level. Okay,
and I'm looking at this, it kind of looks very consistent. People would generally say their overall health is very good or excellent. I don't know if that's the most accurate, or if people tend to just say that, but it looks very consistent.
Yeah, so what we're looking at this slide is, about 57% in 2011 for the BRFSS say that their health is excellent or very good. And that compares to about 59% from the last time we ran that survey, and to the national, to the state level of 57%, and to the national level of 53%. So consistent in Winnebago County. The other thing you'll notice on these slides, at the top there are some arrows that are colored. These yellow arrows just indicate that we haven't really seen a change in the data on the left-hand side in comparison to the previous survey that we did, and on the right side we haven't seen a change in the data locally to what's occurring at the state or national level. So we're on about the same same rates at the state and national level. Green arrows will indicate improvement. Red arrows will indicate where we have slipped in some of our areas. Healthcare checkup, very important, and this is really good news too. Prevention is the key to great health, and that really begins with monitoring your health and seeing your doctor at least annually. So this is a measure of whether you've seen your doctor in the past, what time frame, and 70% in Winnebago County have seen their doctor in the last year. That is an improvement. We'd like to get that number higher. And it's really important, and what I want to emphasize here is that it's really important that even if you're young and healthy and you don't feel like you need to go into the doctor, you really should at least once a year if you can. Things like high blood pressure, diabetes, prediabetes, high cholesterol are things that you can have and not know it. You don't necessarily have symptoms, and those are things that can affect your health later in your life, and it's important to identify those early. So
and that relationship building too, so that you know your doctor and have that rapport built when something goes wrong.
Yep. Yep. So moving on, another indicator we check on is vegetables. This is an area of concern for us. 2/3 of us get 1 to 2 servings a day. What we'd really like to see is 4 to 6 servings for adults.
Okay.
And a good way for us to help increase our vegetable intake is just to have a salad with every dinner. MyPlate.gov is an excellent resource for looking at what should be on your plate, some ways to incorporate more healthy foods on your plate, and would encourage you to use that, and you can check out our website for that link. With fruits, we'd like to see one 1.5 to 2 cups daily, about the same for kids. And fruits are great snacks between meals, and that's where we'd certainly ask people to try to incorporate more fruits into their diet. Another area is exercise participation. We'd really like to see more people get more exercise, and even if that just starts with 10 minutes a day, starting someplace. If you're one of those 16% that you see on the left here that have not in the last month participated in any physical activity, we'd like you to consider just trying something out, just going for a walk or doing something that increases your heart rate a little bit. For moderate exercise, basically exercise that is going to increase your heart rate and your breathing rate, and those would be things like brisk walking, bicycling, gardening. We see that of those that participate in exercise, at least 91% of you do that 10 minutes at a time. With moderate exercise, this is a graph on how many days per week you do them. Here we'd like to see, we have about 63% that are doing it 4 or more days. We'd certainly like to get that rate up. Those that are doing it only 1 or 2 days a week, we'd like to see an increase. Another factor, diabetes, that we took a look at. Diabetes is a lifelong chronic disease in which there's high levels of sugar in the blood. This is an area that we had special emphasis on this survey because we wanted to get more data about diabetes. So it's important to get your blood sugar checked annually. And you can see here that with diabetes, we've had a trend downward, or we've had more people identified with diabetes. And that, you have to be careful when you interpret that data. It may just mean that we're doing a better job of testing people and identifying it. So we have to use that with other sources of data. Most people are taking insulin. Glucose check, we certainly want to have people have they're part of their regular physical exam, and also if they're known to be diabetic, check daily to determine where they're at with their diabetes management. And of course, obviously, see a health professional, at least annually, probably more often if you're a diabetic. Cardiovascular high blood pressure. We certainly like to see that here, 86%. This is a new question for this year, an area that we want to talk about. We wanted to make sure that we knew what the rates of having your blood pressure checked by a medical professional was, and about 86% have it checked at least every year. Ideally, everyone would have that checked every year. And of those that have gone in, you can see that 31% have been told they have high blood pressure. So you're not alone. That's why it's important to get that blood pressure checked on a regular basis. Same thing with cholesterol. You can see here that that rates of cholesterol, while we're doing better, it's common for people to have high levels of cholesterol, and so you should have that checked regularly. And you can see here that also approximately a third of all people have been told that they have high cholesterol. Smoking rates and alcohol next. You can see here that we're doing well with smoking, but we're kind of stagnating with some of that. And most people are not smoking at home or in their vehicle. Alcohol is a big concern for Wisconsin. We know that Wisconsin has very high rates of adult alcohol consumption, and certainly extremely high rates of binge drinking, which is 5 or more drinks for men, 4 for women in Wisconsin.
Okay. Well, that's a snapshot of the highlights of public health. And where else can we find this information if people want to really peruse it and use it for their own data sources?
We can find this data on our website, on rethinkwinnebago.org, or at the county website, co.winnebago.wi.us. Okay. And you can also find other sources of data there that we use, so that you can take a look at some of the data sources that we use to make decisions and prioritize our limited funds. Excellent.
And we want people to go there. We want them to look at that and be aware of, for their own organizations, and as they're setting goals too, to be mindful of that. Mm-hmm. So thank you for sharing. That's a lot of information in a short time, but that just gets us thinking about it.